Hello and welcome to the GRADD Dialogue. As time goes on in our society and also in our families, mental health plays a bigger role. And with the kind of pressure we all have, it getting bigger and bigger as far as an issue. So today, my guest is Dr. Lionel Phelps. Dr. Lionel Phelps is the Vice President of the Continuous Quality Improvement for River Valley Behavioral Health. He has been a mental health first aid instructor since 2011 and has provided training to medical professionals, clergy, universities, firefighters, social service agencies, and general public. And we have used his expertise with the social service providers and the counselors and the case managers, even grad staff, the people we contract with to take care of the senior citizens and the people in need. So he has been a tremendous help to us in this region as far as when it comes to mental health. So mental health first aid. So Dr. Phelps, welcome on the GRADD Dialogue.
Thank you.
Let me start out saying that I have heard you in the past. You've probably done about, since 2013 or so, you've been, having some, one way or the other, have some sort of training for the social service professionals on mental health. And you refer to mental health first aid.
Yes.
Can I explain what is that?
All right. So really, we started this in Kentucky around 2012. So mental health first aid is an 8-hour course, and it is anyone can take it. So it's more of a public education program. So if you think of regular CPR, so those people who are not medical professionals, anyone can take CPR, and it's a way to kind of help someone that may be experiencing, for example, a heart condition or heart attack. So mental health first aid is the way in which a person can respond to a person experiencing a mental health crisis. So we cover a huge number of topics in that 8 hours, and it helps people by empowering them with knowledge about mental health issues.
Especially for the folks who are either, like they mentioned, the fire department, the firefighters, or even police departments, and including our staff, who deal with the clients, the citizens, and everything else. So what you're talking about is us to recognize some sort of signs of mental health. So sometimes there are no misinterpretation and end up being something else. Is that the more?
Sure. Okay. So you can kind of think about who are the players when it comes to the fabric of the community. It's not just social services providers or medical professionals, but you've got first responders, EMS, police officers. You've got schools, higher education. So the National Council, who has kind of taken the initiative of mental health first aid, which by the way was originated in Australia. So it came to the United States after that. So we work with those individuals who have the possibility of coming into contact with someone who could be experiencing a mental health crisis, because typically a person that's having a mental health crisis won't come to someone like me first. They'll be experiencing the crisis in their own homes or at their school or, in the community. So we want to teach as many people who we can about how to respond, because a lot of times it's just a matter of just knowing that it's simpler than you think.
So it is kind of correlating to the first aid that we all been, a mainstream knowledge about.
Yes.
Recognizing somebody needs some help in the first aid and then finding some help for that too.
Sure.
So this is also the same thing in a way that these experts or the people who are working in that social service or any kind of field recognize somebody may be needing some mental health aid and then finding a help.
Right. So in our profession, in our field, especially those that work with those with mental illness, there's prevention, there's treatment, and there's recovery. So mental health first aid is really designed to catch that person when they're just starting to become unwell. So not when they are, acutely ill, but when they're starting to become unwell, because the prevention and early treatment are really key in kind of keeping the symptoms from becoming too acute.
Can you kind of give an example of how mental health aid is so important? Maybe, that you might come across that somebody mentioned to you that somebody misdiagnosed and it was really mental health aid, not
Well,
something
I'll give you an
else.
example. And, we know statistically that 1 out of 5 people will experience a mental health crisis at least once in their lifetime. But often people overlook the signs of depression.
Yeah.
So where some people who are depressed may look sad, or they may act sad, other people may express depression as anger or irritability. So a lot of people may not necessarily know that when they are, talking to their neighbor or their family member or even a student or someone, that actually what they're looking at is depression. And the earlier that you recognize and treat depression, the better the prognosis is.
So I mean, it is there's a lot of services being provided when it comes to depression, but that to me that's coming after somebody recognizing that is a
correct,
mental health
right?
aid.
So a lot of times, by the time they get to a mental health professional, they've actually been sick for 4 or 5 years, or sometimes even a decade. So, and then typically it results in maybe a hospitalization, and that's a really acute a situation. So what we want to do is help people to recognize the early symptoms, the early signs, get help for it, and then what we see is that the outcomes aren't so severe. The person recovers quickly, and they recognize that mental health problems are actually more common than we realize.
Now, is this symptoms of mental health, is it more prevalent in certain populations, certain socioeconomic factors or anything?
Well, so we know that, for example, women experience anxiety and depression almost twice the rate of men. Some age groups experience suicidal ideation. For example, teenagers, older males experience more thinking about suicide, for example. So yes, the demographics in terms of what mental illness looks like in different groups, it varies from population to population.
Oh, I see. And that's why you're trying to train the professionals to recognize in all different segments of the population.
Sure, and with mental health first aid, we want to train everybody. So even maybe even a concerned citizen or a family member of someone who is trying to help a loved one, we want to teach them about what mental illness is, what it isn't, what to look for, how to help them, how to really get them the appropriate help.
You mentioned that anybody can take this course.
Yes.
Let's talk about the course. What is involved in the course, and how long does it take, and everything else?
So mental health first aid is an 8-hour course, and generally what we do is we teach all of the major types of illnesses. So, for example, we talk about depression, anxiety disorders. We talk about substance abuse. We talk about psychosis. And we teach people as much as we can in those 8 hours about what to look for, what are the signs and symptoms. But most importantly, we teach a 5-step action plan. And that 5-step action plan is about assessing for risk of suicide or harm, helping people understand that they have to listen non-judgmentally whenever you're talking to someone, and then how to offer them reassurance and if need be, how that person can get that person to help. And it could be a matter of just going with them or giving them some resources. So we give a lot of information and resources to people who go through the training. And we've had lots and lots of individuals attend it from the community here.
So really, just thinking about what you just mentioned, even parents,
yes,
may want to be trained into those things.
Sure.
Because you mentioned about the teenage suicidal issue,
right?
Or anybody who feel like themselves or somebody could have potential of being mental health.
Correct. So it's there's actually several evidences for improvement whenever you go through the course. So the person that goes through the training often feels more confident to be able to help someone, whether it's a family member or neighbor or a student or whomever. But it also improves their own mental health or their own mental wellness by helping them understand that some things that we experience are quite normal, and other things could be signs of more deeper underlying issues.
So by having that more population being trained to all those things, so you're probably providing a crisis diagnosis or
There
something.
you go. Yeah, so we
Okay.
want to extend our reach in the community. There's not enough mental health professionals in most communities, including ours. And so if we can train as many people as we can to be kind of the first responders, it improves a person's access to getting help.
In your field, in your profession, you've been in this almost quite a few years.
16 years.
16
yes.
years. So any kind of trend that you're seeing, that has any benefits about the mental health first aid, or maybe more resources or more efforts needs to be made? Or?
I think that more people are starting to come forward and recognize that they may be experiencing a mental health crisis. I think they're talking more realistically and honestly with their medical professionals about what's going on. Another trend that I am very happy about is that more of the medical community are asking the right questions about mental health status, and so that's really one of our first lines of defense is the general practitioners.
Just thinking, on the other hand, it seems like we use that as an excuse of any action that we don't agree with. Oh, the person must be having a mental health, must be having some issues.
Right. It's because it's mysterious.
It's mysterious.
So it's an age-old question about what is mental illness and where does it come from. And there's lots of theories about where it originates, but we do know that there are biological factors, there are biochemical factors involved, and as I tell a lot of people, we wouldn't hesitate to go to our doctor to treat diabetes. So why would that be any different to go to see our doctor about a mental health symptom or a mental disorder?
So having this kind of training to recognize it, but also having this kind of training to even understand that I may be going through those things, kind of takes away some of the stigma about being in the mental health issues.
Right, and I think the education gives you power and knowledge.
So you mentioned about that there are some, the 5 steps process and everything else, but it's also, the facilities or the professionals who would provide the treatment after the first aid diagnosis, something, Yeah. Can you tell us about what are those in our region?
Sure. So we have several. We've got a 24-hour suicide and crisis hotline in our area. We've got a variety of outpatient clinics, medical providers that can provide treatment. We've got inpatient facilities. I work for a community mental health center, so we're kind of the safety net for the community in terms of working with serious mental illnesses and, social emotional disorders for children. So we have quite a few resources, but typically if people will call our center and ask for those information, we can provide them anything that they want.
So the telephone number for the
so it's 270-689-6500.
So they can call that for the assistance. And also, I know we have been working with you to provide the training or the course for the professionals. So we can also work with you to even set up additional trainings.
Sure. So we'd be happy to provide. Typically, our mental health first aid groups are about 30 people. So we'd be happy to set up or arrange for trainings and other types of topics involving mental health.
Dr. Phelps, I want to thank you for being on the show, and also thank you for providing the consistent, seems like every certain time or so training, for the professionals, GRADD, and everybody else, for the mental health first aid. I think maybe next time, we can talk about, or at least we want you to work with you to create this awareness more with the people who are in decision-making power, maybe elected officials, the government officials, they got to realize, those who are in leadership, to make things happen, that this is one of those, things that they need to, put more time and effort, as much as they do on ambulance services and first aid and everything else. So this is a great, expertise that you're providing us, and hopefully more and more people will recognize of medical, the first aid for the mental health is equally as important as any other disease that you could have.
Well, thank you. I'd be happy to help.
Well, thank you very much. We've been talking to Dr. Lionel Phelps with the River Valley regarding the mental health first aid, the kind of course that helps you recognize mental health for any professional, even for the layman, even for the parents. And if you have any questions, or even you feel like, some days that you feel like you're going through some mental stress or something, you can always call the River Valley, or you can contact GRADD office, and we can also get you in touch with services being provided in our 7-county region. Thank you and have a great day.